So to answer the first part of the question, whether SARS-CoV-2 can directly infect the liver, we still don't know at this point. So there's data out there suggesting that the liver might be susceptible to SARS-CoV-2 infection because the receptor that is required for SARS-CoV-2 infection is actually expressed a little bit on hepatocytes, but even more on cholangiocytes. So in principle, SARS-CoV-2 should be able, at least in vitro, to infect the liver. However, whether this really does cause the damage that we observe in patients that are infected, we don't know at this point. So that brings me to the second part of the question. What other mechanisms for SARS-CoV-2 induced liver injury have been discussed? And this is really something that we don't know at this point. The liver is very sensitive to all sorts of systemic infections. So what we believe at this point is that a large part of what is happening in the liver in patients with elevated liver function tests and COVID-19 is just the systemic inflammation and the pro-inflammatory cytokines that circulate and that cause damage to the liver. But there could be other factors that play into this. For example, medications that patients then get if they have a severe course of the infection or hepatic congestion. We do outline a lot of these different factors that might contribute to liver injury in the published article in the EASL ESCMID position paper that we've just recently published an update on in the Journal of Hepatology Reports. So in terms of general risk factors for COVID-19, I think these are quite well established, that older age, male sex, metabolic comorbidities such as diabetes, arterial hypertension, obesity, those are risk factors for a severe course of COVID-19. Whether they also increase the risk of getting SARS-CoV-2 infection, I don't think this is really firmly established, but they most certainly contribute to patients that have a severe course of COVID-19. Now, as liver-specific risk factors, we really do not know at this point whether there's any chronic liver disease that will increase a person's susceptibility to SARS-CoV-2 infection. So far, patients in these large cohorts that have been published on COVID-19, patients with chronic liver disease have not been overrepresented in these cohorts, suggesting that chronic liver disease may not be a risk factor for SARS-CoV-2 infection. So what we know is that increasing severity of a chronic liver disease, and that's mostly cirrhosis, and then the different classes of liver cirrhosis, starting with compensated over to decompensated, and then in the end, child C cirrhosis, that this also increases the risk of severe courses of COVID-19. So patients with advanced liver diseases, advanced liver cirrhosis, are most certainly at a high risk for a fatal course. These data have been published by many different groups showing that patients with advanced liver disease do have a significantly increased risk for a severe course. Whether this is, again, liver specific, or whether this is just a multiplication of these two severe diseases is not really known at this point. But most certainly, if a patient with advanced liver disease acquires SARS-CoV-2 infection, he is at a severe risk for a severe course. So in the first phases of the infection, at least here in Europe, when the infections rose in March and April, many centers have closed down or significantly reduced care for patients with chronic liver disease. And this did result in a significant backlog of these patients in the month to come. And also maybe in a reduced quality of care for these patients. So I think we should focus now really on resuming patient care for patients with chronic liver disease. Despite the COVID pandemic, we really should not forget about patients with liver disease, and we really have to maintain a care for those who need it. After all, preventing the progression of chronic liver disease may also prevent these patients from acquiring severe forms of COVID-19. So we really have to make a concerted effort that we maintain care for patients with chronic liver disease despite the COVID-19 pandemic.